51-year-old Newark native, while driving, discovers sudden symptoms in which he pulls over to the side and calls 911. Shortly after, the ambulance comes to assess the situation.
So the ambulance gets there. I'm Phil. I'm part of the ambulance team for Monarch. I find the patient in the driver's seat of his car. He's not responding appropriately. Quick exam leads me to believe that I should move him to my ambulance so I can do a more thorough examination. After I move him to my truck, I'm going to do some vital signs on him. And during the vital signs, I will be taking a blood glucose level on him, which comes back as 50. It's a little low for our concern, so we're going to treat him by starting an IV on him, and we'll give him some sugar. Now, we work in teams of two, so one person is going to be essentially taking care of the patient, assessing the patient, and another person will be primarily doing charting. So it's all done real time. After he wakes up, we're able to establish what kind of medications he takes, any specific medical history that he has. Lucas has decided that he does want to go to the hospital, so we're going to take him to Newark Beth Israel. Since this is a simulation, how we would do this to get to the information to the hospital is I would just save the chart to the server as it is now, and through the portals it would travel and be available in the emergency department. Since we're just simulating this one, IGI has created a portal, and I'm just going to upload a patient care report that contains the same information here. And that will be available after it's done uploading in the ED, which is the next step down the road.
So we're going to receive information that a patient's coming in from the EMS. We're going to look up that patient name on the HIE portal so we can view the information that's been provided by the EMS. Can you confirm there? So in here, we can see the details of the EMS report provided by Monarch. This provides all the detailed information from that encounter. We receive in our HIMSS application, which is our emergency room application, we receive an ADT message registering that patient within our system. Our nurse would go through and triage the patient, which we've already provided most of the information in there, but they'll go through, enter vitals, pre-hospital treatment, current medications, medical surgical history, allergies, etc. They would go through and save and complete that screen.
This was taken from the patient?
This is taken from the patient by the nurse during the encounter. So it keeps track of all patient documentation. They'll go through the assessment screens, which will capture more information from the patient. Medication IVs, progress notes are entered, and then finally a nurse will disposition the patient. Well, they'll discharge that patient going home with instructions to follow up with their primary care physician tomorrow. They're then going to sign off on their nursing documentation and save complete. When they click Save Complete, an HL7 message is automatically generated that captures all of that patient documentation for that encounter. That information is then packaged up, sent over to the HIE system, and is now viewable from the primary care physician and anybody else that has access to the HIE.
Hi, I'm Dr. Stout. You're looking at Allscripts Enterprise EHR. What we've got now is Lucas Lampford is in my office, primary care office. I know that he's been to the emergency room, but I don't really have any of the records. So my staff would actually go and import a clinical exchange document. You choose the appropriate location from the drop-down menu. Here's the note with the information that they've provided to us. We import that. And you can see here, manually imported, and there's the information. So we've got all the data, vitals, diagnoses, whatever testing they may have done included in the record. What I'm now going to do, if you allow me a little time, is I'm going to actually create a new note. I'm just going to say a non-appointment because he wasn't assigned to see me today. I'm going to say he's here for a diabetes follow-up. And again, what I'm showing you here is, again, a real-life example of what we might do. So we'll say at this point in time that he's actually stable, he hasn't had any complications. And then for the interval events, hypoglycemic episode, 1 day ago, as an example. We'll say that he checks his glucose sporadically at this point in time. And for speed's sake, I'm simply going to give him a normal review of systems. We've got the system so that it automatically pulls in his active medical problems. Current medications, and notably here, there's none. I'm going to add a medication that you'll see then is going to be exported when we're done. Allergies are here, vitals are populating in. Any results and data would come if need be. And again, for time's sake, I'm going to say he has a normal examination. So we go to our assessment. He's, of course, got diabetes. We then go to our care guide, an organized order set. I'm going to go a little outside of the set here, though, and we're going to order metformin. The script says we're going to give him insulin, but really in real life I would use metformin on this gentleman, so that's what I'm going to do. So we're going to give him metformin, 1 pill twice daily with meals. This is automatically going to populate his appropriate pharmacies. So we've just sent off a prescription for him electronically, and we're going to send him to the nurse. So that's the diabetic education referral. And we're going to say we're going to send the records, and we need a consult exam and testing for consult for an adult. So we save and close this. I'm going to show you the note that we've just created, and then I'll show you how we export the note. So here is the note that we just created on the patient. So now what we do is we want to export that note so that the nurse has it available, again, the information flowing to her through HIE. So again, select medical summary, and I'm saying diabetes education. And it pulls up the form to show you what you are indeed sending. So there's our medication, our metformin that we added to his meds, and we exported it, and it's literally that easy.
Exported to where?
Goes through HIE, but we've exported it in this scenario to the nurse. We wanted this guy to get home-based healthcare through nursing. And so we've literally just exported that. And so here's our manual export that we just did. And that's the information that they'll now have available to them.
Are you a real doctor?
I'm a real doctor.
The first thing we're going to do is we're going to log into the HIE, and I'm going to see what Monarch and the ER and Dr. Stout put in for Lucas. See, I have the visits here. So first we'll look at the ambulance, see what's going on. Low blood sugar, lethargic, disoriented. I'm going to use this information to kind of beef up what's in my system. And next I'll be able to see what he uploaded. Primarily looking for things like medications if I can. Okay, I don't see any here. Let me see if he's got anything here. Nothing there. And one more. And this is the ED. And the ED says, I'm looking for something to add to my document for you. Glyburide oral. So I'm going to go from here into my software, which our nurses use in the field, and I'm going to edit the meds. So I'm going to void the insulin, and I'm going to add glyburide. Okay, so we'll do a 5. And I pre-did a lot of the admission visit because otherwise you'd be here for quite a while watching me put all this in. So normally we would take as much information as we could and get as much in there, but I entered a lot of it beforehand. So I'm saving my meds, I'm signing that I added it. So now that we've completed the referral, I'm going to sign out. The patient would sign. And I'm going to synchronize this back to my office side. And from there, we'll upload the document to the HIE. Once I get it on there and you move to Sita's table, she's going to show you the document I uploaded with all of our orders, medications, diagnoses, interventions, goals more home care based things. So this will just take a minute. The synchronization's pretty quick. It goes back over Verizon to the servers.
Is all this software upgraded via the web, on an ongoing basis?
Uh-huh.
Because obviously with the changes of medications and drugs, and it's got to be something that's a routine
Oh yeah,
software.
definitely. We do it a lot. Okay. So I'm going to save it as a PDF. Eventually, this will stream automatically. There is a direct link between our two softwares. All right. And I'm going to upload it to the HIE so that when you get over to CETA, she can show you what I've uploaded. Okay. Okay. So all of our nurses' orders and everything would go in and then go into the same database that they all viewed and submitted their information to. And that's how we're going to go back and forth pretty much. So that's it for us.
Welcome to the home of Lucas Lamford, who is our patient today, who has gone through a turmoil day, having gone through the Monarch ambulance to the ED, been to his physician. The visiting nurse visited him also. He's been trained to use the portal, which is the HIE portal, with the patient portal, and is able to now access the information that has been provided for him across the spectrum of care that he has been given. Currently, you can see he can add his own profile, his contact information, which can then be shared by everybody in the HIE. He can actually manage his weight, his blood pressure, glucose. These can also be connected to mobile devices. He can further come into the medical care and look at the episodes of care that he has gone through for today or for the time frame that he's part of the HIE. He's been to the emergency room, as you can see. He can click on the details and see exactly what work was done by the emergency department at the first juncture that you had stopped at. He can further look at his patient docs, and he can get access to a consent that he had given that the HIE can use it, so he was an opt-in patient in this case. And he can also look at the episode summary. That was the aggregated summary that you saw at the VNA when they provided care to him. And the most important piece of information, like I always like to point out, is this is a human readable format for a patient to be able to see the data. It is not as cryptic as you saw in the first one. Furthermore, he very clearly can see what his allergies are, and as well as his medication list and the vital signs that he had when he was visited by this visiting nurse. So the patient can now take care of himself as well as share his information with other entities that are going to provide to him today or going forward, and maintain a history of it. Thank you. I'm going to first speak to the Healthy City HIE, which is a ONC-funded HIE located in Greater Newark. We have 9 hospitals signed in and more signing up as we go along. We have FQHCs, vendors, physicians, clinicians who are starting to use this system to share data on patient care. The questions of opt-in, opt-out, consent is always there, and we're dealing with them with the New Jersey state as well as with each hospital entity as we go through HIPAA consent management. The data truly resides in the hospitals itself, which is called the edges, and we built the core, and at the core we actually are collecting all the indexing. So the true patient information is where it is. It never leaves the facilities. So your lab results, your medication resides where we just maintain an index saying, hey, this patient has been to these hospitals or has been to the emergency room or has been to, say, an FQHC. And when someone tries to gather information or get clinical information on them, we're able to aggregate it and present it to them. Also, you have break the glass, where an emergency room at the time, if a patient comes in and has no clue or is delirious, they are able to come into this, search for the patient, and get all the information on that patient regardless of where it is. One of the things that we're not going to be moving on this platform at the moment is all your behavioral health information, your HIV information, until such time as we're able to find consent on that. Any questions on?
And this is an opt-in system?
It has 4 categories in it. Some places it's opt-in, some places you are part of the system. For example, If your doctor has seen you at the hospital and now they want to see your lab results in their EMR, you already gave consent that they can see it. If they can see it on paper, they can see it electronically. So there's no need to opt in or opt out because that's the current flow. So one channel follows the current flow the way it is. The second is some insurance companies say, if you want to be part of my insurance company or you want to be part of this ACO, you are going to be allowing us to share the information with this constitution of people. So we are able to build a model such that we can say, this patient can be viewed by U4 and this patient can be viewed by U3, and hence when there's any information on that patient, it can be viewed by the people who are part of that ACO or part of that insurance company group that has provided this facility. And of course, opt-in is always there. And you can see we have two opt-ins. One is what we call access sharing opt-in, and one is called HIE opt-in. Access sharing is I'm going to share my data with you too. HIE is I'm going to allow them to send the data to you too. So there's two parts of opt-in in this model.
Okay, again, I'm John Perkins with MobileMD. We're the other HIE vendor participating today. Our product provides the repository for the separate healthcare organizations to be able to share information, much like IGI. We actually maintain a separate data center where that information is all stored, so we provide that as an outsourced activity, so you don't need to have the server and the IT staff internal to do that. We take care of all that for you. Then we're able to integrate the information, much like you've seen today, where the individual PHRs or EMRs are providing the data into us. We're taking that information and providing that out to either be queried via our portal product, Enterprise Access, and or push it out directly to the EMRs, and you can access it via native. We provide all this information. Currently, we're integrating with IGI via the XDS protocols. We also are compatible with the Connect protocols. So if you're working with a system that's providing information or sharing information via Connect, then we have that built in out of the box with our product.